Hello, and welcome to Joint Ventures. In this OSC original podcast, we take a look at recent medical news, trends, and headlines. We're here to dig through the noise, pulling together the information you need to understand these complex topics. Our goal is to be a trusted resource to help you make decisions about your healthcare. Now, before we get too far into today's topic, let us introduce ourselves. I'm Dr. Jenny Andrus, and I'm an interventional pain management physician at Orthopedic and Spine Center in Newport News, Virginia.
And I'm Dr. Andrew Martin. I'm a pain psychologist at Orthopedic and Spine Center. I work with the pain management and orthopedics teams to help reduce and manage chronic pain.
Now, today we're kind of piggybacking off of a previous discussion about cognitive behavioral therapy and mindfulness. Mindfulness seems to be everywhere now, and when a lot of people hear it, they think Asian tradition, yoga, man buns, tribal tattoos, and walking over hot coals and not feeling anything. And I can assure you, we don't have a yoga studio or any hot coals at OSC. So since Dr. Martin is really an expert in this area, and I can confirm does not have a man bun, he's here to clear up some misconceptions and help us understand how this applies to chronic pain management.
Yeah, so we often hear mindfulness meditation described that way in those contexts, but it's a lot simpler than that. Mindfulness simply means thinking about something neutral or pleasant for a little while, and when the mind gets distracted, noticing the distraction, and gently bringing attention back to the neutral or pleasant thing. Now, the Asian connection, that's important. They've known about the psychological and physical health benefits of mindfulness for about 2,000 years. It's well integrated. Yeah, they beat us. It's well integrated into a lot of their medical systems as a first choice treatment for several diagnoses. In the US, we've been discovering mindfulness slowly over the last several decades. And while this might sound a bit like I'm selling snake oil, mindfulness meditation has been repeatedly proven to improve mood, energy, concentration and focus, sense of control, sleep, self-confidence, problem-solving, anxiety, anger, blood flow, muscle tension, blood pressure, and heart rate.
That's a mouthful. That actually makes sense because all of those things are affected by the nervous system, and mindfulness acts directly on the nervous system, relaxing it.
Yes, and it is great to watch someone experience that for the first time, especially if they've been stressed for so long. They don't even remember what it is like to be relaxed. I remember my first mindfulness experience. I was a stressed out psychology intern co-facilitating a fibromyalgia group with my supervisor. He led a mindfulness exercise, and I just sort of got caught up in it, following along with the patients. And at the end of the session, I practically floated out of the room.
There are a lot of different types of mindfulness meditation, not medication, folks, like guided imagery, diaphragmatic breathing, and progressive muscle relaxation that addresses different problems. I understand different people find different types useful, so experimenting with different types of meditation can be helpful.
So we're going to try this out live with a stressed out type A doctor.
Now, you do know that the running joke at OSC is that they don't have enough time in the schedule for me, for you.
So, we'll do the most basic variety here, diaphragmatic breathing, or breathing from the stomach version. I should mention this is not hypnosis, and you are in control the whole time.
Thank goodness.
It's extremely unlikely, but if someone begins to feel uncomfortable, you can simply stop following along, after which you'll almost certainly feel instantly better. I've never had that happen. This one can be done standing, sitting, or lying down. But if you're doing something like driving right now, pause this and come back to it later. So if you're somewhere that's safe to have your eyes closed, that's best. Okay, so there are two important rules for success here. The first is if you feel like moving around and shifting position during the exercise, then do it. Shift your posture, scratch an itch, move to relieve pain if you can, whatever. You don't have to be still like a statue for this. Second, and most important, do not attempt to empty your mind because that's impossible to do. The brain is full of thoughts all the time, flying around. Don't try to stop them. And finally, there will be some long pauses during this. I haven't fallen asleep and your player is probably still working.
All right, y'all, we're going to try this on a type A doctor, see how successful Dr. Martin can be.
Ooh, pressure's on. Okay, let's get started. If you're comfortable doing so, close your eyes. To begin to learn how to breathe from the belly, you may want to place one hand on your belly at the waistline and the other hand on the center of your chest. Notice when you breathe in how the belly balloons out slightly. And when you breathe out, the belly goes back in. Without forcing anything, see if you can breathe in a little deeper once, so that your belly balloons out a little more. Like a soft balloon filling with air. And then, as you breathe out completely, slow down the process once. Feel the belly going back down as you exhale. Like you're gradually letting the air out of the balloon. As you continue breathing in and out, slowly and deeply, notice the difference between the hand on your chest and the hand on your belly. You may feel the chest rise and fall slightly with the in-breath and the out-breath, but the hand on the belly will rise and fall to a greater degree. Breathing like this is the natural form of breathing for all of us when we're in a relaxed, restful state. Once you get a feel for how the belly rises and falls with this kind of breathing, you can remove your hands and rest them on your lap or at your sides if you like. We can breathe like this on purpose, anytime, to quiet the body and the mind and bring about the relaxation response. Let's keep doing this for a few more moments. Breathing in, deep and slow. And breathing out a little slower than you breathe in. On the in-breath, notice your belly ballooning out, like you're filling up that soft balloon. On the out-breath, notice your belly going back in. Notice that as you breathe in, your chest may rise a little, but your belly balloons out quite a bit more. There is more movement in your belly than in your chest. As you breathe out, your belly deflates like a balloon with the air let out. Let your breathing be deep and slow and regular, at a pace and a depth that is right for you. There's nothing you need to force or make uncomfortable for yourself in any way. Don't try to breathe. Just watch your breathing, however it is. As you continue to breathe in and out from the belly. Notice how your body feels. There may be some sense of quieting in the body. Notice as you breathe this way that your thoughts may also be quieting down somewhat. When your mind drifts away from your breathing and a thought does capture your attention, that's perfectly okay. It's not a mistake. It's not a failure. Just notice that you're having the thought and then let it go. Gently bringing your attention back to your belly breathing. Breathing in, deep and slow and regular. Breathing out, deep and slow and regular. And when you are distracted again by another thought, a feeling, a body sensation, or a sound around you, it's nice to know you can simply notice that distraction, let it go, and then gently bring your focus back to your belly breathing. Over and over, again and again, as often as you like. Breathing in, deep and slow and regular. Breathing out, deep and slow and regular. Noticing your in-breath and noticing your out-breath. And then, whenever you are ready, you can let your awareness of the breath fade into the background. And you can bring your awareness back to your surroundings. You might want to wiggle your fingers and toes a bit, maybe move your shoulders a few times. And if you've been practicing with your eyes closed, go ahead and open them when you are ready, alert, refreshed, and relaxed.
Perfect. We'll pause there. Good.
I did that twice.
Y'all, that is the first time I have ever tried this. And I am not kidding. I can say that that really works. It'd probably be better if I wasn't recording a podcast, but it really worked. That's amazing.
Now, if you didn't have such a strong reaction, it's okay. It may mean you're already relaxed.
But how often should people do this and for how long?
Great questions. But before I forget, let me ask everyone off the top of your head, how long did it feel like we were doing that? Most people say it feels like 1 to 2, 3 minutes, but it was actually about 10 minutes from eyes closed to eyes open. If you're surprised by that, then that's proof that something changed in your brain so that you stopped noticing the passage of time. Now, you don't have to do this for 10, 15 minutes every time. Once practiced, the majority of people can get results from as little as 30 seconds. People who make this a regular part of their life and practice several times a week tend to experience greater and greater results, up to about the 3-month mark. And at the 3-month mark, that's when you can actually see in an MRI of the brain changes as a result of spending more time relaxed and less in fight or flight mode. So the pain centers of the brain shrink down and other parts of the brain get thicker with stronger connections and better chemical and electrical activity.
Now, are there resources if we want to practice at home? I mean, I guess people could replay this podcast,
Yep.
maybe.
Yeah, and if you want to hear a very similar version and a female voice, I borrowed heavily from a script written by Beverly Thorne, the author of a chronic pain treatment manual that I use. So you can find an audio file of her reading the original version of this by searching Guilford Press, Thorne, Thorn, and audio. The app Calm, Calm, has several similar scripts you can play from your phone. A similar no-cost app is the Breathe to Relax app.
Well, my friends, there is hope for you because this relaxed, this type A doctor, I'm not kidding. I feel like I just had a cocktail on the beach. And I hope you learned something, but please subscribe to our podcast. We don't want you to miss out on any further episodes or future episodes. Thank you again. Wishing you good health. See you soon. I'm going to go take a nap. Bye.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.